Hi, this is Reliable RN, Kathleen King, and we're talking about listen to your gut today. So, we're going to talk a little bit about normal gut function, what it looks like, and maybe what to do when it's not functioning so well. Okay, so normal gut function. Our digestive system is there, it absorbs useful nutrients, gets rid of our waste, right? It starts when we start to smell the food, when we start preparing food, sight or smell activates secretions, and that helps us to break down our food. We are like giant donuts. We have a hole from our mouth all the way to our anus. We literally, our bodies have a hole all the way through it. I tell this to third graders, and they get quite a kick out of the fact that there's a hole all the way through their body. Why does gut health matter so much? So, gut flora also influences how our immune system behaves. And I love this quote, it's like a mother child relationship. So, the bacteria in our gut help to teach our immune system how to recognize good versus harmful microorganisms. In this way, what it does is it actually helps our immune system to know what a normal response is and what an abnormal response is. So if it comes across a threat that is a bad bacteria that's going to harm us, you want it to attack with full force. But if it's dust or pollen or some type of microbe, we don't want it to attack. We don't need it to attack. Our body's mostly healthy. That teaching goes on in our gut. So, flora. We talk a lot when we talk about digestion, we talk about bacterial flora or our gut flora. So there's good and bad bacteria always in our gut. We have some level of good and bad. It needs to be balanced. We need to have more good than we have bad. The good will keep the bad under check as long as there's enough good bacteria. So these are just types of different bacteria that we do find routinely in our gut. And the only important thing about this is that our good has to balance off the bad. We need enough good to keep the bad in check. Normal bowel basics. So, what does normal mean? So, for bowel movements, there's no exact number. It varies for each person, but there's a basic rule of three, and that means you should be having stool anywhere between 3 times a day and 3 times a week. So, 3 times a week is pretty much every other day, just so we're clear. For people who tell me that it's normal that I only go every 3 or 4 days, that does not fall under quote unquote normal. Okay. And probably not healthy for you. So, rule of three, anywhere between 3 times a day and 3 times a week. Appearance and consistency can vary from person to person. We mostly care when it changes, but in general, formed, brown, and soft is what we call normal. There shouldn't be pain. If you have pain with normal, if you have pain, you're not having normal gut function. Pain is not ever considered part of normal. Yes, we sometimes have gas pain, but you can kind of move your stomach around and maybe you go to the bathroom and then it's fine. That's different. If you feel a stabbing pain in your abdomen area or as you're digesting food, that is not normal. We all need to poop to survive, right? There's a great kids book, Everybody Poops, right? The reason is our body doesn't have any other way to get rid of these particular wastes, right? So as food goes through our digestive system, one waste from our body is put uh, into our gut, but also we're taking out the food. But what we don't need has to get excreted, it has to go away somewhere. When when the intestines are not working well, when things stay too long in our intestines, the body starts to overreact. It's very concerned that there's an infection. It's very concerned that the immune system has to react to it. So it can actually damage your organs when you allow stool to stay for too long. So what if my normal is different from regular normal, right? plenty of times we have some irregularity. Intermittent irregularity, we're not overly concerned about. Occasional dysfunction is okay. If you have it, if you have diarrhea, we want to prevent dehydration. So we want you to take small sips of water often, eat soup or broth. You could even suck on popsicles or ice chips. And we want to have a simple diet. So a binding diet, we'd call a brat diet is what's normally recommended. And that's bananas, rice, apple, or toast, or a combination of those, brat. If it's constipation, there's plenty of reasons why you might have constipation. Some medicines, pain medications cause constipation. Pregnancy can cause constipation. Stress certainly causes it. Not getting enough water or an unhealthy diet can cause it. So when we talk about treatments, the easiest things to do is start reversing the reasons, right? So healthy diet, drinking lots of water, getting exercise helps. Also, you might need medication. Certain people, especially as we age, our digestive system slows down. So you might need a medication like Miralax or Senna to help get your the muscles within your digestive system to move a little faster. We call it like a sluggish system. So if it's sluggish, you might actually need something to make it go a little faster. When should you call your primary care? Blood in your stool. If your stool looks black or it's bright red, it's not normal. You need to call your primary care. Pain that is not relieved by using the bathroom. Intense pain, especially stabbing pain, could be something very serious like an appendicitis or an ectopic pregnancy. So you want to have that looked at. Fever, nausea, headache, or feeling dizzy, you're going to call the primary care. The dizzy part is what we worry about. If you've had diarrhea, or you've had the flu for a while, you might be dehydrated. And if you're starting to feel dizzy, you might need some fluid support. And that's why you'd call your primary care. Explosive stool. Often something like that could be caused by an illness called C. diff or a parasite. Both of those probably will need a medication treatment, and it'll probably be a medication that will need to be prescribed. So that's why you call your primary care then. Most common chronic gut illnesses. So the ones that we mostly talk about is IBS, that's irritable bowel syndrome. There's also irritable bowel disease. For irritable bowel syndrome, 12% of the US actually have it. Most likely women. You're more likely to have IBS if you're a female. And younger people tend to have IBS. Crohn's is a subdivision. It's kind of almost a more intense type of irritable bowel syndrome. And ulcerative colitis is actually when you have ulcers inside your larger intestine, and those can actually be bleeding often. Diverticulitis and diverticulosis is an irritation of the colon. Sometimes it's just inflammation. Sometimes it also could lead to bleeding. And celiac. Celiac is an allergy, and what it does is the digestive system struggles with digesting wheat. And so what happens is if you have wheat and you're allergic to it, with celiac, what happens is the healthy intestine tends to get flattened down. And so you have actually less area to absorb the nutrients you need. And for those who don't know, gluten is simply another name for wheat. So anything that has wheat in it is not something you should eat. Now, just to be clear, there's wheat in a lot more things than you think. A lot of soups have it, beer has it. So gluten, it's not just white bread. You have to be very careful about what does actually contain gluten. And there's just a picture here of what healthy small intestine looks like and what it looks like with celiac disease if the celiac disease is not caught early or if you continue to eat wheat. And now irritable bowel syndrome versus irritable bowel disease. If you notice, they both kind of have abdominal pain, cramping, changes in bowel movements. Irritable bowel syndrome is more common. it's bloating, it's gas, people don't feel great. But inflammatory bowel disease, so notice it says inflammatory, so you have inflammation, but also bloody stool, fatigue, reduced appetite, unintended weight loss. Now, going back, Crohn's versus IBS. Again, IBS is more common than Crohn's, but Crohn's, what takes it apart a little bit is that it can have, you could have mouth sores, you could have sores anywhere through the digestive system. So in your mouth, in your throat, your stomach. Whereas IBS, you tend to have abdominal pain and cramping and a bloated feeling and maybe mucus in the stool, but it kind of has to do with the back end of your system. The other thing is Crohn's. They can have people who have Crohn's. It is an autoimmune disease. They could also have other issues like dermatological issues. They could have sores on their skin, other issues that go along with autoimmunity. So Crohn's versus ulcerative colitis. Ulcerative colitis, just think of the two words, ulcers on the colon, right? So you actually get ulcers on this back bigger part of your digestive system called the colon. And these ulcers can be bleeding. They often have, people with ulcerative colitis often have grossly bloody stools. And if you have ulcerative colitis, you also could have other manifestations. So like manifestations in the spine, inflammation in the eyes. You could have thromboembolisms. For Crohn's, the issue is there is blood in your stool, but it's detectable by test only, generally. It also involves inflammation, and Crohn's can also cause recurrent urinary tract infections. And like I said, other manifestations like other dermatological things on your skin. So gut issues are usually due to either flora, which is the good and bad bacteria we talked about, allergy, which would be celiac, or autoimmune disease. And autoimmune disease, it's because inflammatory bowel disease or Crohn's and ulcerative colitis are all diagnosed as autoimmune diseases. And what autoimmune means is that there's a problem with your immune system, right? Your immune system starts attacking healthy tissue by mistake and damages them. So instead of only going after an infection, your immune system is now targeting healthy cells within your gut. Most autoimmune diseases cause inflammation that produces redness, heat, pain, and swelling. And there's where you get your pain. No one is sure what causes autoimmune diseases. There's no set. I can't go and look at a book and say, well, the reason that anybody has an autoimmune disease is. The suspects are genetics and environmental causes. So we do see more autoimmune diseases of the gut in North America than we do anywhere else in the world, which could lend itself towards thinking that the environment has a role. So notice that most gut illnesses are affected by inflammation and stress. We've just talked about that. Inflammation and stress. We have to find a way to somehow limit the stress that we're under in general. We really struggle with this in general as a society. So in a normal, healthy system, you have outer loose mucus and an inner mucus layer that kind of protects your epithelium. So it lets food in, but it doesn't let in any of the other microbacteria or the microbe world. However, with stress, there's damage to the inner mucus layer. And once the inner mucus layer is damaged or destroyed, you now have microbial dysbiosis. Dysbiosis just means bad environment, right? So if you look in the picture, what they're trying to depict is that your microorganisms are all over the place, including in your epithelium, in your skin, in your inner skin, in your digestive system. And so what that does is that causes inflammation. And that inflammation basically is telling your immune system, uh-oh, we have a problem. And so your immune system comes after that full force. So what happens is you get this dysregulated immune response because you can't tolerate all of the microbes that are coming into the epithelial. So that's why stress is such a big deal, and why stress and inflammation create kind of a feedback loop. When you get inflammation, you get a bad immune response. When you get a bad immune response, it causes more stress. More stress damages the mucus layer, and it becomes a pretty bad cycle. So general ways to enhance gut function and manage chronic gut illnesses. One, healthy diet. No surprise, right? We've talked about this almost every webinar. Manage stress levels, emotional, mental, or physical stress levels. If you are cold, if you that's a physical assault. If you're so cold you can't get warm, you need to dress properly. Things like that. Emotional stress, mental stress, whatever it is that can actually affect your gut function. Exercise. Please try to get exercise daily. A 20-minute walk. We're not looking for major calisthenics or, uh, going out and playing 2 hours of basketball. Just looking for some regular exercise. An appropriate amount of water, right? We need enough water. 64 ounces is about considered the normal. Avoid cautionary foods identified by your gastroenterologist. If you have a gastroenterologist because you've had chronic gut issues, work with them to come up with the foods you need to identify that shouldn't be in your diet, that aren't working for you, and foods that might actually help your digestion. A nutritionist might be helpful also if you don't work with your gastroenterologist. Take medication as prescribed. If you're given medication for a chronic gut illness, by all means, please take it. It's important. Include pre and probiotics whenever possible. Definitely when you have antibiotic use. If you get ordered antibiotics for, let's say, a strep throat or a pneumonia, you want to start a probiotic at the same time. So prebiotics, they're plant fibers that feed the good bacteria that are already living in your gut. So food with prebiotics are onions, asparagus, bananas, artichokes, garlic. Probiotics, on the other hand, are actual living microorganisms that we add to your gut, right? So you take either a pill, you take a food, and that actually deposits good bacteria into your gut. Food with probiotics are yogurt, kombucha, which, by the way, also does have a low level amount of alcohol. So if you're in recovery, you should just know that. Miso, kimchi, sauerkraut, also a lactobacillus. If you went to the store and got a lactobacillus tablet, that would actually increase the good bacteria in your gut. And I threw this in there because there is some latest research that bacteriophages, which are viruses that infect bacteria cells, might be able to be used to target gut bacteria that worsen the symptoms of ulcerative colitis and Crohn's, which I thought was interesting. They're also kind of looking at stem cells. So there might be some new treatments on the horizon for chronic sufferers, for ulcerative colitis, or for Crohn's. And I'd love to say that this is all really new information, but Hippocrates, back in 460 BCE, mentioned that all diseases begin in the gut. So this is not new information. This is actually very, very, very old information, that we need to pay attention to our gut, and we need to pay attention to how we feed it and how we get rid of waste. Hippocrates also said each of the substances of a man's diet acts upon his body and changes it in some ways. And upon these changes, his whole life depends. So we actually do really know that right now. And this is a huge area of research. We're talking mental health. We're talking cancer. It's not just about the digestion. It's about the immune system. It's about hormonal balance. It's about neuroreceptors that cross the brain-blood barrier. So if you're having issues with your gut, if you would like to talk about test results, if you're concerned and you don't know where to go from here, by all means, reach out. I'm Reliable RN, www.reliablern.com. Thank you so much for being part of this webinar, and I hope to see you for the December